is really trying to get out today. She put out 2 liters from her Foley already. The nurse said she's marathoning her way around the floor. Well, if she doesn't get out today, our list is going to crumble under its own weight. Not unlike my lunch tray yesterday. Oh, hey, you're the new 3rd year, right? You're right on time. We're just about to run the list. Are you okay? She looks a little pale. You're going to be okay. Don't be nervous. We're going to walk you through everything. Just come over here, sit down, drink some water, and here's some coffee. You're going to need it. Maybe we should start from the beginning. If you're going to survive this rotation, there are 3 things you need to be prepared for: pre-op, operating room, and post-op rounds. Let's start with Miss Garland. She's going to the operating room today, and you get to scrub in. There are a few things you should know before you go.
Ashley, you ready for your first DNC?
Yeah, totally. Let's do it.
You know we're doing a vaginal hysterectomy today, right? Did you even read about this case? Get out of my OR!
One of the most important things for you to know before going to the operating room is why you're going to the OR. Review your patient's medical history, know what procedure she's having done, and the indications and risks of that procedure. If there's one thing you should be fluent in as a 3rd-year medical student, it's anatomy. Review the anatomy relevant to the case, including surrounding structures that may be prone to injury in the procedure. Practice your suturing and knot tying. You may get asked to assist. Before the case, be sure to introduce yourself to the patient in pre-op. Ask her how she's feeling and do a brief exam. Let your team know of any changes and update the H&P if necessary. All right, let's try this again.
Ashley, ready for your first DNC?
Oh, I thought this was Miss Garland, the vaginal hysterectomy.
Right. You actually read about this case. Rule number 1, always know why you're going to the OR. Get up.
Let's time out. This is Miss Garland. She's 59 years old, here for a vaginal hysterectomy. She received her preoperative antibiotics. She has no known allergies. She's in the dorsal lithotomy position. Any special requests?
No.
And the fire extinguisher is not present. Do we all agree?
Yes.
I'm Libra, the circulating nurse.
Dr. Courts, the attending.
I'm Ashley, 3rd-year medical student. I'm Daryl, the scrub tech.
Okay, let's get started. So tell me, Ashley, why are we doing that hysterectomy for our patient today?
Well, she's had a 5-year history of abnormal postmenopausal uterine bleeding. Her workup for endometrial cancer has been negative so far, and medical management hasn't been effective in stopping her bleeding.
What are the other indications for a hysterectomy?
Uterine leiomyomas, pelvic organ prolapse, malignancy, pelvic pain?
Pubocervical ligament, uterosacral ligament, round ligament, broad ligament. What's missing?
Well, Dr. Courts, you're missing the 5th ligament associated with the uterus, McEnroth's or the cardinal ligament.
Excellent. Come on down here and throw in some sutures into the vaginal cuff.
Okay. You're back. So, you've got the OR under your belt. Now let's talk about preparing for rounds. So, this is Mrs. Washington. She's 64. She's status post TAH, BSO for,
What post-op day is it?
she's post-op day 2. Day 2.
And is she meeting her post-op goals?
She's walking and she's passing gas.
Okay. Is she voiding on her own?
I think they took the Foley out yesterday.
Miss Washington? So, the Foley came out yesterday?
Being systematic and organized in pre-rounds will help this go smoothly. First, check in with the night team and your patient's nurses to find out about any acute overnight events. Then, look through the patient chart for information in the objective portion of your SOAP presentation. Be sure to get 24-hour ranges for vital signs and labs. Monitoring fluid balance is very important in surgical patients, so always gather the ins and outs for the past day. Jot down key findings from imaging studies as well. Lastly, review the patient's medication administration record, taking note of the medicines that have been added or discontinued in the past day. Then, go examine your patient. Ask about their progress on post-op goals, which include pain control, nutrition, ambulation, voiding, and bowel function. Don't forget on your exam to check on the drains and the Foley bag if your patient has one. Here we go again.
This is Mrs. Washington. She is a 64-year-old post-op day 2 status post.
Presenting in a SOAP format is a great way to stay organized and not miss any key information during your patient presentation. One way to shine on rounds as a third year is to have an assessment of your patient and propose a plan for the day based on your findings during pre-rounds. If you have questions, get input from your resident on your plan ahead of time, and then you'll be ready to present to the attending and the whole team.
My plan today is to transition her off of her PCA to oral pain medication. She lives here in the city with her husband and daughter and is a potential discharge home tomorrow if she continues to do well.
Okay, perfect. Let's go see her.
You did a great job today. Hopefully you got some pearls about preparing for pre-op, the operating room, and post-op rounds. We'll see you tomorrow, 5 a.m. for pre-rounding. Get some sleep. You're gonna be okay. Don't be nervous. It's okay.
I'm Dr. Bliss, not.
Ashley, you ready for your first?
Action. You're back! So, you've got the OR under your belt. Let's talk about pre-rounding. Let's not talk about